Across the globe, health officials are closely monitoring a recent uptick in cases of human metapneumovirus, or HMPV. This respiratory virus, while not new to the medical community, has been appearing more frequently in recent months, particularly in China and the United States. While the overall scale of infections remains lower than last year's respiratory illness surge, the increase in HMPV cases serves as a stark reminder of the ever-present threat posed by infectious diseases. The good news is that the situation is not currently a cause for panic. However, understanding HMPV, its symptoms and preventative measures is crucial for everyone. The rise in HMPV cases is not entirely unexpected, as respiratory viruses tend to circulate more widely during the winter months. However, the increased detection of HMPV could also be attributed to heightened awareness and more comprehensive testing practices following the COVID-19 pandemic. Discovered in 2001, HMPV is a member of the family, a group of viruses that also includes respiratory syncytial virus, RSV. Like its viral cousins, HMPV primarily affects the respiratory system, causing a range of symptoms that can mimic other common respiratory illnesses. The symptoms of HMPV are often difficult to distinguish from those of other respiratory infections such as the common cold, the flu, or COVID-19. Common symptoms include cough, nasal congestion, fever, and shortness of breath. Transmission of HMPV occurs through respiratory droplets produced when an infected person coughs or sneezes. These droplets can infect others directly through the air or indirectly by contaminating surfaces that are then touched by uninfected individuals. While HMPV can infect people of all ages, young children and older adults are particularly susceptible to developing more severe complications. In these vulnerable populations, HMPV infection can progress to bronchitis or pneumonia, requiring hospitalization and more intensive medical care. Currently, there is no specific antiviral treatment for HMPV. Management of the infection primarily focuses on alleviating symptoms and providing supportive care. This may include the use of bronchodilators to open airways, fluids to prevent dehydration, and medication to reduce fever. In cases of bacterial co-infection, antibiotics may also be necessary. Despite the lack of a vaccine, there are several effective measures that individuals can take to protect themselves and others from HMPV infection. The most crucial of these are practicing good hygiene, such as frequent hand washing with soap and water, covering coughs and sneezes with a tissue or elbow, and avoiding close contact with sick individuals. It is also essential to stay home from work, school, or social gatherings when experiencing symptoms of respiratory illness to prevent further spread. While the increased prevalence of HMPV may seem concerning, it is important to remember that most people experience mild, self-limiting illness. By understanding the virus, its transmission, and the steps we can take to mitigate its spread, we can effectively navigate this latest public health challenge.